Dan Poenaru. I'm a pediatric surgeon and senior investigator at the Research Institute of McGill.
Why is medical technology one of the most dynamic and impactful fields for students to explore today?
I think it's a very interesting aspect to study for medical students because it is where medicine is going. It's where many aspects of medicine, the domains of medicine are going towards leveraging technology, including AI, for improving patient care. So this is the future of medicine.
How can students contribute to advancements in robotics, AI, and telemedicine that are shaping the future of surgery?
I think that the reason why students are very important in this endeavor is that there's still a fair bit of inertia within the medical community towards various technologies, which again, there's a very broad range of technologies. In the US, the industry drives these developments, and it's happening whether doctors or surgeons want it or not. This is simply the state of the art and what is required for them to do. While in Canada, because we're a single payer system, there's no such industry drive. So that's where, in fact, medical students and undergraduates or students in general have the opportunity to be drivers by getting excited and then moving forward with projects like this and spearheading and requesting projects like this that will move things forward within surgery in our own setting.
What unique learning experiences or research opportunities are available to students in programs focused on medical technology?
It depends very much on the programs, and each one offers different things. There's skills that are learned, such as coding skills or technology development skills, startup development, lots of those types of opportunities. There are more instructional opportunities where they can learn cognitively some of these things, but there's also many workshops or settings in which this can be learned on the project. And if they can align themselves with any of these projects, wherever they may happen, and there's multiple institutions connected to McGill where this can happen, then they have the opportunity to learn these things while applying them in their actual, in the lab or in the clinical setting.
Can you explain the real-world impact of medical technology and how students can help bring these innovations to life?
Real-world impact is, again, something that we rarely see, and therefore we're skeptical about it. But when one sees that, and again, looking down south of the border, we do see these things in action, these things already being applied, then they have the opportunity to catch that vision and then bring that vision to our setting. As an example, it is currently stated that probably after all the hype related to generative AI, a surgeon's life will be improved and the efficiency of their work will be improved by somewhere around 15 to 20%. That's a huge improvement, but you see that only once you have adopted that technology and once it's there. In our own lab, we've had the opportunity to see this, and we tasted this reality. And once you taste the reality, there's no looking back. There's no doing things the old way, let's say with natural language processing, once you've learned about LLMs. And it just moves forward. And I think that students are just that perfect factor, ingredient that can bring us as a group, as a provider group to move forward and to embrace this future, which is not, if not already here, it's definitely what's coming up for us.
Do you have a message for prospective students in your field of research of medical technology?
Yes, I think that the students applying need to be very very directive and intentional about it. You need to, if you want to be involved in this technological revolution, you need to align yourself with labs that are involved in this, and therefore looking for labs where such research is happening, um, asking your supervisor to what extent new technologies will be leveraged in the projects that they will be doing, surgical, clinical, bench research, or whatever it is, that will allow it, you can be clear that you're going somewhere where things will happen and where you'll be able to meet this. Together with that, I think it's very important for the students themselves to prepare themselves. When I look at CVs of students, I definitely choose for my lab those that do code in Python, those that have had exposure to these courses, whether they're at McGill offered in their courses, in their programs on Udemy, but they're students that are prepared for the technological revolution. They've got some of the tools that they need for this, and therefore they can immediately hit the ground running in a lab to make a difference. And that's what every supervisor dreams of.